Hello, and welcome to the Cancer Grace video on Tumor Treating Fields. Grace is a nonprofit founded to provide free and accurate cancer education to patients and their advocates. I'm happy to be here today to talk about this technology. So what are tumor treating fields? Tumor treating fields, also sometimes referred to as alternating electric field therapy, are a cancer treating modality that utilizes mild electrical currents to disrupt cell division. According to Johns Hopkins University, this field of interruption may slow down a tumor's growth as well as its ability to spread. These fields are delivered to the patient via a wearable, portable device and appear to have no effect on healthy cells. What types of cancer can be treated via tumor treating fields, also called TT fields? Currently, TT fields therapy has been approved by the FDA to treat inoperable pleural mesothelioma and glioblastoma multiforme, the most common and aggressive primary human brain cancer. A recent study by Dr. Tiziana Leal of Winship Cancer Institute et al. Has determined there may be a benefit of the therapy in non-small cell lung cancer patients as well. However, several other preclinical studies are underway to evaluate its effectiveness in a variety of cancer types, including renal, breast, and colorectal cancers. What about trial data for currently approved therapies? There was a study called the EF14 trial on a type of brain cancer called glioblastoma multiforme. It was a landmark study because it was the first study in 10 years to find that adding a chemotherapy drug called temozolomide, or TMZ, to the usual treatment could help patients live longer. After patients finished their initial treatment of chemotherapy and radiation, some were randomly chosen to also get a new treatment called TT fields along with more chemotherapy. This combination helped them live about 4.9 months longer on average compared to those who didn't get TT fields. The good news is that this new treatment didn't seem to cause more side effects. Because of this study, the FDA approved TT fields for treating glioblastoma multiforme in 2015. As for mesothelioma, the STELLAR study was conducted. It was for patients who hadn't been treated before and had a certain type of mesothelioma that couldn't be removed with surgery. To join the study, patients had to be at least 18 years old, in decent health, and have at least one tumor that doctors could measure or evaluate. Patients in the study received TT fields, and they also received chemotherapy every 3 weeks for up to 6 cycles. After chemotherapy, patients who didn't have progression could keep using TT fields until their cancer progressed, they or their doctor decided to stop, or they had too many side effects. 80 patients were enrolled in the study. Median follow-up was 12.5 months. Median overall survival was 18.2 months. The most common side effects were anemia, found in 9 or 11% of patients, neutropenia, found in 7 or 9% of patients, and thrombocytopenia, found in 4 or 5% of the patients. Skin reaction was the only adverse event associated with TT fields and was reported as grade 1 to 2 in 53 or 66% of patients, and as grade 3 in 4 or 5% of the patients. No treatment-related deaths were observed. However, this was a single-arm study, and additional studies with more randomized data may inform the true value of adding TT fields in treatment for mesothelioma. This study does not reflect standard practice, as there is no clear randomized data. That's a lot of numbers and data, but what does it mean? Well, in both studies, patients showed an increase in their survival time. They also didn't have any major side effects from the treatment itself. So how does TT fields treatment work? The most widely used system, Optune, consists of 4 transducer arrays, a field generator, and a power source. The transducer arrays are attached to the patient's skin, and the field generator delivers electric fields through the transducer arrays to target the tumor. Ideally, the device is worn for 18 to 20 hours per day. If targeting a brain tumor, then patients will need to shave their hair. What about side effects, cost? These are valid and important questions. The main side effect seen in patients undergoing TT fields therapy is skin irritation at the site of application. Patients may develop contact dermatitis due to prolonged exposure to sweat, hydrogel, adhesive, or a combination of these factors. However, skin complications are usually of low grade and can easily be managed by topical corticosteroids, modification of array positioning, or protecting the skin with sterile dressing pads. Cost is unfortunately a factor for many patients when discussing their treatment options. Currently, Novocure is the sole producer of this device, and it rents it to patients for an average cost of $21,000 per month. However, this cost includes transducer arrays, array layout planning, patient-physician training, and 24-hour technical support. Also, many insurance companies offer coverage for the device. Talk to your insurance company for information about this treatment coverage in your plan. Another concern is the cumbersome nature of the treatment as a whole. As stated earlier, patients need to wear this device for 18 to 20 hours per day, and while there is a marginal survivor benefit in glioblastoma multiforme, there isn't a clear benefit in patients with mesothelioma. Patients may wish to take that into consideration when determining if they wish to utilize this treatment option. Overall, Tumor Treating Fields are an intriguing topic that shows some promise in the field. There will need to be more studies done to investigate the overall effectiveness of the device on other cancer types, as well as to solidify the findings of the current studies. The treatment has a low risk of side effects, but a high price point, which must be taken into consideration for accessibility. Thank you for joining me today to discuss this interesting topic. For more information on cancer treatment options, emerging technologies, and educational content, please visit us at cancergrace.org.